So, you know, Ayurveda is recognized globally for its holistic approach, and during this complex time, this is a right topic. We need to Ayurvedic doctors. We need to be prepared to treat any disease. And since you know, when it comes to cancer treatment, there's a lot of dilemma. There's a lot of confusion regarding when to begin Ayurveda, when should we enter, what should be the decision, and all that. So today, in the upcoming 1 hour, we'll be discussing in brief. I do not have a lot of time to go in depth about all the concepts, but still we'll be brushing through the details, and I'll teach you. I'm hoping that after this session, you will get confidence to deal with cancer patient. At least if a patient walks into your clinic, what to do, what not to do, that definitely you will come to know. So first question is, why Ayurveda is needed in cancer care? Why shouldn't we stick on to just conventional treatment? Why chemo, radiation or immunotherapy isn't sufficient? So, you know, cancer treatment, the conventional treatment comes with a lot of challenges. Okay, it is cytotoxic, that is toxic to the normal cells as well as cancer cells, and the patient is crippled because of the side effects post-treatment. So there's a famous saying that if a patient does not die because of the disease in cancer, he or she will die because of the treatment. So that is why we need a holistic approach. So Ayurveda is famous and well known for its holistic approach to almost all the diseases. That is why we need something that supports the conventional treatment, something that complements. So Ayurveda works beautifully as a complementary treatment as well as an alternative in those patients who are refractory to the conventional medicine. And we need a comprehensive approach. So we are not discussing only about conventional allopathic treatment or only about dealing with cancer through Ayurveda. Okay, so Ayurveda does not replace allopathy. We're not speaking about replacing it, but we are adding it. So we need an integrated, comprehensive approach through integrating both the sciences. So we have systemic approach to supporting cancer patients. We can support them. We can, starting with prevention and standalone treatment in those patients who are not fit for chemo, radiation, advanced cases, sometimes post-treatment, to prevent recurrence, to prolong the remission stage. In all those conditions, Ayurveda can support the conventional treatments. So we are discussing about evidence. It is definitely, there is a lot of studies that are going on. There's a lot of evidence, based on how Ayurvedic therapeutic approach helps in cancer patients. So another question is survival enough? Because when it comes to conventional medicine, we are more focused on the survival of the patient. Does the patient live for 5 years? So most of the oncologists, most of the doctors are not bothered about the quality of life. I'm sure living 5 years after the treatment is a big deal, but how does the patient survive? Do they have a good appetite, good metabolism? Are they bedridden? So some patients, even after treatment, they should be hospitalized for a very long time. They do not have the the quality of life that they should have had otherwise. So all these things brings us to the question: is survival enough? No. So cancer is not just about fighting the disease, or it's not just about focusing on the disease. It's also about dealing with the entire person. So cancer treatment should address a person's physical, emotional, and financial, and then spiritual. All that aspects of a person has to be addressed while dealing with treatment. So it's not just giving medicine. It's also about understanding their mental well-being. It's also giving, supportive treatments like maybe yoga, maybe pranayama, helping them go through or, deal with their emotional traumas. All that is part of the treatment. So conventional treatment, because of its severe side effects, it usually, like I told, it cripples a patient. So we need a treatment. We need Ayurveda to come forward and help the patient move effortlessly through the treatment so that the patient will have a better quality of life. Now, discussing about the therapeutic framework of Ayurveda. So how do we address cancer in Ayurveda? So what is the concept? Though we have a lot of terms like Granthi, Arbuda, Apachi, or we have Vidradi, so many terms are there in Ayurveda, but none of them are fit for the entire disease, cancer. We cannot say that Arbuda equal to cancer. That is not possible. Why? Because in Ayurveda, First thing is like we do not have a lot of information regarding Arbudo Granthi in our text. And moreover, cancer is not a single disease. So there are almost more than 240 varieties of cancers. So if you look at the pathology, if you look at the the presentation of the disease, we can see that it mimics asadhya condition of many vyadis. Or again, if a person during their cancer journey, they go through different stages. So these different stages represent different diseases in Ayurveda. Patient might have Pandu, they might have Kamala later on, Udara manifest, so many things. Okay, so Dushi Visham, so many concepts are there in Ayurveda. So we cannot say that this particular disease can be equated to cancer. And that is why, as usual, we view cancer or oncology through the lens of Tridoshas. So cancer is a Tridosha Vyadi. Definitely, all the all the doshas are involved. But what is the predominant dosha in a patient at that particular time? That is more important. Now, I always say this: for us, for Ayurveda doctors to treat cancer, we must understand the basics of the disease. We must understand modern oncology as well. At least the carcinogenesis, how a healthy cell gets converted to cancer cell. If you know this, you know what is happening in the body, how this doshic imbalance converts a normal cell into cancerous cell, then it is easy for you to treat. So let's take the doshas, Vata, Pitta, Kapha. These three are involved in converting a normal cell. So what happens? Vata is involved with movement. So all the signaling pathways in a cell. Basically, if there is a damage in the cell and this damaged cell is dividing, so what this damage or DNA damage can be called as mutation. For example, the cell is damaged. So in a normal setup, in a normal body, the damaged cell is not allowed to divide. It should undergo self-destruction or suicide called apoptosis. Okay, or the macrophages will destroy the cell. But in a faulty, in an imbalanced condition, if there is derangement, imbalance in tridoshas. So when I say tridosha, I mean tridoshas in a cell, in a single cell, not the entire body. So in a cell, if there is imbalance, what happens? There will be faulty signaling pathways. The damaged cell might get signal to divide. So it is not getting a signal to stop division. There is a fault in that. Again, Pitta, it is involved, it is related to inflammation, metabolism, mitochondria in the cell. So if there is deranged Pitta, what happens? There will be metabolic imbalances, reactive oxygen species will be created, oxidative stress, then mitochondrial damage will happen. All this will trigger inflammation and further it can lead to mutation. Kapha. So Kapha is responsible for the structure of a cell. So all this sanghata, this integrity, this excessive cell material or the macromolecules that is needed for supporting this excessive cell growth comes from Kapha dosha. So this is how tridoshas work in a cell and leads to carcinogenesis. Next is our therapeutic target. So what should be the target of a treatment? Agni and Ama. So definitely in a cancer patients, their Agni will be deranged. Like I told, mitochondrial damage is the first step in a cell that leads to cancer formation. So your mitochondria is damaged, there is Vidahitu in the cell, there is Agni Mandya, and there is chronic inflammation, Dhatu Agni Mandya. So Ama is present. What is Ama? It's nothing but chronic inflammation in the tissues. So our treatment should target this. So we need to correct the Agni, we need to reduce the inflammation, reduce the Ama. So through this indirect method, we are leading to reduction in the tumor burden. So our medicines, Ayurvedic herbs or herbal preparations do not directly go and destroy the DNA in a cancer cell. We are not cytotoxic. Okay, our medicine or interventions are not cytotoxic, but this is one of the methods through which we deal with the tumor burden. Then comes Dhatu strengthening sequence like Rasayana therapy, okay, systemic recovery protocols. Even if the patient undergoes conventional treatment, even if there is toxicity in the body, we need a mechanism to recover the body out of it. So this is how we view cancer through the lens of Ayurveda. So next topic is therapeutic categorization of cancer patients. So when a cancer patient walks into your clinic, they might be already diagnosed, or it's very rare that patient comes to Ayurveda physicians, primarily, and we get to diagnose the condition. That's very rare. Usually, patient comes with a bundle of reports and they'll be diagnosed. They'll have PET scan, they'll have biopsy, and everything will be ready. Already, they'll be in discussion with their oncologist as in what should be the treatment. So surgery will be suggested, later on chemo, radiation, all this will be going on. But the patient wants to know if there is any other alternative that is there. Okay. Some patients, they are die-hard fans of Ayurveda. They truly believe that Ayurveda can heal them. So I'm not against them. The thing is like, as a physician, our duty is to guide the patient. So not all cases are suitable for conventional treatment. So not all cases are suitable for Ayurveda. So there are certain conditions wherein we need to make the decision. The patient doesn't know anything about their disease. Definitely, they know it is cancer, but they don't know what is outcome, what is the prognosis, what treatment has to be done, and they don't know what is the possible side effects of the treatment. Okay, so they would want you to take the decision. This is a very tough situation, and if we do not know about the disease, if you do not know what is the outcome of the conventional treatment, where we have to step in, then it will be very difficult for you to make a decision. So that is what we are going to discuss today. So therapeutically, patients who come to a clinic can be classified like this. First one is newly diagnosed case. They have not undergone any conventional treatment, not even surgery. So the patient is fresh, the patient is having disease, but we can give them some preparatory therapies in case the patient is willing to go for chemo, radiation, or surgery. So these preparatory therapies are normally Shodhana procedure. Otherwise, Panchakarma or Shodhana is not of much help in cancer cases because since it is Bahudosha Avastha, Tridosha Vyadhi, by giving Shodhana, we might be driving the toxins deeper into the tissues and doing more harm than good. But these cases, newly diagnosed cases with adequate strength, will come to that later on. So in those patients, we can use preparatory treatments, okay, to strengthen and to prepare them for the conventional medicine. Next group of patients are who are already under active treatments. They have undergone 3 cycles of chemo, 6 cycles. So they're just waiting for the further treatments. So these patients come to you when they suffer or when they face side effects or they feel that the effect of the treatment is not much. This usually happens. Some patients, after 3 cycles, they are put through PET scan. Then there will be 50% reduction, or there might be a new lesion somewhere. So patient has partially lost hope and they feel like, okay, I need something else side by side. These patients can be given supportive treatments in the form of medicine and sometimes mild Shodhana. Okay. Mostly Rasayana and Shamana Aushadhis are given in the form of supportive treatment to reduce the side effects and also help the patient move smoothly through the treatments. The next group is who have completed all their treatment, post-treatment, surgery, chemo, radiation, immunotherapy, everything is over. They are in the cancer survivorship program. Some of them might be cancer-free, basically disease-free. I wouldn't say they're cured. It's just that they're in the disease-free state. So they're in remission. So what is our intention there? To maintain remission, to prevent recurrence. Because cancer is one disease which can recur anytime. 6 months, 1 year, you don't know when it's going to come back. So if the patient does not take care of the tissues, if they do not take care of the inflammation, then there is always a chance of the cancer coming back. So we can use restorative therapies. We can use Rasayana treatments here to rebuild tissues and prevent recurrence. So see, some patients, they easily rebound. They come out of the treatment. They might not have any side effect. They'll be perfectly all right. But not all have that luck. So some of them might have a lot of side effects, especially after radiation therapy and all that. So this post-treatment phase, it's very important. That window period between next upcoming scan and the treatments, that is what we call as post-treatment. And last phase is advanced stage. So those patients who are in stage 4 and who are having comorbidities like diabetes mellitus, cardiac conditions, or maybe some lung issues, COPD and all that. Those patients who are not fit for any other treatments. Another factor here is age factor. Patients who are above 75, 80. So in them, like patient itself decide, I do not live for more than 5 or 10 years. I do not want to undergo all these harsh treatments, and they might come to advanced stage. Or advanced stage also consists of patients who are refractory cases, who have already undergone conventional treatment and they faced recurrence. The tumor grew after the treatment. So there also the patient is not fit for any other treatment. So these are all the conditions where we go for palliative treatment. So palliative does not mean it is end of life or the patient will die in 6 months or 1 year. Palliative treatment can be given for 3 years, 4 years. So Shaman Aushadhis can help the patient survive for a very long period. So here we are focusing on symptom management and improving the quality of life. So we cannot give Shodhan or any other harsh preparations. So this is how we therapeutically categorize cancer patients. So let's discuss about pre-treatment preparatory therapies. So this usually starts 1 to 2 weeks before the actual conventional treatment. And our intention is improving patient resilience before that. So patient has to, because see, cancer patients might have a lot of symptoms. They are not purely, they do not have good appetite and all that. So you need to improve the appetite, make sure the patient is having good bowel movement, the patient is eating well. These are all the intentions. So preparatory treatment does not mean you're addressing the tumor, you're addressing the disease. You're just preparing the patient first. How do you prepare a patient for Virechana Vamana? The same thing is followed here. So Deepana Pachana can be given because Agni, like I told, Agni month is definitely there. Even though the patient says, I'm eating well, I do not have any issue, you still have to give the Pachana Deepana Aushadhis. And that also depending on the strength of the patient. Normally, you can give Hingashta Churna or Hingachati, Vaishyanam, anything based on the patient's condition. Also, the location of the tumor is very important. And if the patient is very weak or the patient is, not in a position, or some patients might not tolerate even the Chitragati Vadi, they might have all that eruptions and all that. In those conditions, you can simply go for Trikadu. So Trikadu is very safe. Dose again 1 to 3 gram for meals, or if it's tablet, 2 BD and all that. Maximum up to 7 to 14 days pre-treatment. So ask them to take it on a daily basis. We can also give Shadangapani and all that. Anything, mild Pasana Deepana measures can be used here. So the outcome should be improvement in treatment tolerance. Because, like I already told, Sushruta has mentioned about Shodhana before incision, before Chetana in Granthi or Arbuda. Because if you do not prepare the patient and the patient directly undergoes surgery, what happens? The Vyadhi Vishesha is removed. So what growth is there, it is removed, but the Samprapti remains the same. What is Chikitsa? It is Samprapti Vikadana. We are not breaking the Samprapti. What happened there? What Nidanas is the patient indulging? Okay, all those is not reversed. So by doing this preparatory therapies, by doing Pachanadipana and Mrutu Shodhana, we are removing that Samprapti, and then during surgery, the Vyadhi is removed. So basically, the patient is tumor-free after the surgery. And Mrutu Shodhana can be done. Mrutu Shodhana is not necessary in all the patients. If it is CA colon, CS trauma, I do not advise this. Otherwise, if it is a lymphoma patient, non-Hodgkin's lymphoma, they are the best, patients are fit for all these preparatory and Shodhana methods because it is involving entire lymphatic channel. So Shodhana is a must there. Okay. So again, brain tumor or maybe breast cancer patients who are undergoing surgery, all those patients you can go for this preparatory therapies. Mrutu Shodhana, initiate the patient is having pain or inflammation based on inflammatory markers, etc. You can advise Sarvanga Dhanya Amladhara 1 to 3 days maximum. Then you can go for Virechana. If the patient is fit and healthy, maybe Mrutu Abhyanga is also possible, not an issue. Or if the patient is having skin eruptions or pain and all that, maybe Dashamola Shidadar, all that based on the conditions. So it's not fixed, it's personalized. Mrutu Virechana can be given based on the condition. Either you can use Eranda Thaila based on the posture and all that, or Avipattikara Churna. So Avipattikara Churna will be safe. Morning, they might pass like motion for 5 to 6 times, but the patient will not get tired easily. Again, the patient is anxious, the patient does not have good sleep, etc. You can go for Shirodhara or Takradhara, etc. Okay, so these are the simple preparatory steps that we take. Finally, you can also advise Rasayana therapy. So after all this Deepana Pachana and all that, you can start giving Rasayana. You can ask them to take Brahma Rasayana, Amrita Prashabrita, or Indukanda, Indukanda Buddham, etc. So this Rasayana preparations in the Leha form, or you can also simply give Draksha Vikashaya. That is also a wonderful, Rasayana. So this will help the patient deal with the stressful treatment. So the Rasayana they have to continue throughout their conventional treatment. Even if it is surgery, post-surgery, let them have that. There's no issue. It is not going to interfere with the Agni. Even if the patient is not fit for Deepana Pachana, you can maybe straight away start with Amrita Prashabrita, Brahma Rasayana. So next is like how we can support the patients during their treatment. So supportive is always tissue protective. You're protecting the normal, healthy, bone marrow cells. You're protecting your hair follicles, your mucosa, GM mucosa. All these cells, they divide rapidly. So rapidly divided cells will be targeted by the chemotherapy. So we need to protect these organs. And mainly, most importantly, you have to protect liver. So when it comes to cancer, liver is the most important organ. The moment it has gone to liver, then there's nothing we can do. You can just prolong the survival, maybe help the patient live for 6 months or something like that. But there's always a chance of rapid progression of the disease. So make sure that these treatments do not damage the liver. And also, your medicine should not lead to liver damage. That is also very important. So what are therapeutic interventions during chemoradiation? First thing is basically managing the side effects. So we cannot predict in the beginning what might be the side effects. So most of the drugs, some of them are, toxic to the kidney, nephrotoxic, some are neurotoxic. So basically, based on the chemo drug that is used, you have some possible side effects. But again, it depends on person to person. Fatigue is very common. This is what we usually see because body is recovering from the cytotoxic treatment. And over a period of time, in another 2 to 3 cycles, patient might see myelosuppression, bone marrow suppression. The hemoglobin count may go down. Some might have febrile neutropenia. Sometimes pancytopenia will be seen. Usually, hemoglobin and WBC goes down. So that is because of the suppression, bone marrow suppression. Anorexia, because of the treatment, they might have like loss of taste, loss of appetite, and that aruchi, all those features will be. These are all some of the commonly seen side effects. Then GM mucositis, patient feels there is burning sensation, not able to eat. Sometimes they vomit, depending on the disease. But otherwise, normally we will have this misconception that the patient will have nausea, vomiting during that usually will not be seen because when a patient undergoes chemotherapy, all the pre-medications are given. Like steroids will be given, antiemetics will be given along with the IV, so that the patient does not have any immediate side effect. So in chemo, we have like immediate, delayed, and late side effects. So normally, immediate side effects will be usually managed by allopathy itself. Patient do not vomit and all that. What we are going to manage is usually the late side effects. Okay, delayed side effects over a period of by the next cycle, the patient will improve. So all this anorexia, mucositis and all that, they'll improve in a period of 14 days or 21 days. We are dealing with the delayed side effects. What comes usually after the treatment? So myelosuppression might prolong. So you have to address it like Pandu. You can use Drakshadika Shaya, Annabedisindharam can be given, Swarnamakshika Basma, Amlaki Rasayana, all these mild medicines which can support the formation of blood cells. And in case of Aruchi, you can go with Shankavati. You can use HT Madhusar, it heals the mucosa. Triphala can be given for a good bowel movement. Some patients also face with constipation. Brahma Rasayana it can be given during chemo and radiation. So it is both chemoprotective, radioprotective, and is also a radiosensitizer. So it actually pushes the cancer cell or it makes the cancer cell vulnerable to the radiation therapy. So you just mildly manage. If there is mucositis, you can use Kadaradevadi. So something like that. So you can, we'll see later on what is the concept of chemo and how we can deal with it. Again, radiation, immediate side effects, very less. Same thing will be seen, fatigue, bone marrow suppression and all that, oral mucositis. Because radiation therapy is usually given in oral CA, throat CA, cervical cancer, rectal sometimes, and whole brain radiation. So, CA breast, in some patients, post chemo radiation will be given. In other conditions, we usually do not go except if it is palliative to reduce the pain in case of bone metastasis. If the cancer is spread to the vertebra, there is spinal cord compression. To relieve the compression and pain, usually 10 cycles of palliative radiation. Otherwise, radiation is not given in any other cancers. So radiation usually in the oral area, there will be oral mucositis. Cervicitis will be there. Patient might have mucosal damage in the rectum. There might be bleeding. There might be passing of mucus plug in the stool. So all these are the immediate side effects. This can prolong and can lead to proctitis. Sometimes bladder recurrent urinary tract infection will be seen in those patients. The patient might have ulcerations, yeast, candidiasis. All these are seen in patients who undergo radiation. And very rarely, sometimes radiation burns in the skin is also a manifestation. So to prevent that, so in case of radiation patients, To prevent this mucositis and all that burns, you have to start the treatment at least 5 days before radiation. So what do? You ask them to apply local application of Yeshti Madhu powder mixed with honey or ghee in the oral cavity. 5 days prior to radiation, you ask them to take them. And during radiation, when the patient is undergoing the treatment, ask them to apply the oral cavity and lie for the treatment. Okay, so this will help prevent the mucosal damage. And oral administration of Triphala prior to the radiotherapy will help them deal with the treatment. There will be less damage to the mucosa. Then, during the treatment and also post-treatment, Kavala Gandusha using maybe Saptasadadika Shayam or, anything like Triphala plus Yeshti Madhu combination. And if there is candidiasis, you can also add a pinch of Tangana Sandhuram. This is antibacterial. So those kind of things can be used after that. And some patients might have very thick saliva. So this is an indication that the patient might end up in candidiasis or yeast infection. So ask them to repeatedly do Kavala Gandusha. Panchavalkala Kwata can be used. It's very good if there is ulceration, especially. So all these are what we do during the during radiation therapy. Then we have to protect the organs. So we have organ-specific protectants both during chemo and radiation. Radiation can have a lot of effect on the lungs, especially in CA breast. So it might lead to pulmonary fibrosis. The problem with radiation is, compared to chemo, radiation has late side effects. As in, the side effects sometimes manifest after 1 to 2 years. The patient might feel like, okay, he's completely safe. But after 2 years, suddenly they'll have bleeding in stool, mucositis, and cough and chest pain, all that, like respiratory manifestations, and there might be fluid in the lungs. So this is one issue with radiation. So we need to protect the organ. How? We can use Vasa, Kantakari formulation, some Leha can be given, Agastya Rasayana can be given, all that. Or after treatment, you can use Ashwagandha, Shatavari, and Vasa, a combination of all that, 5 grams per day, along with 100 ml milk. So it can be given for some time. So this will reduce the toxicity in the organs and protect the organ from further damage. Then some medicines are toxic to the kidney, and radiation to the pelvis is also toxic to the kidney. They might end up with glomerulonephritis, kidney damage. So those patients, after treatment, to flush the kidneys, to remove all the toxicity, you can give them Chandraprabha for some time, maybe 14 to 30 days. Vokshadi Guguli can be given. At least, sometimes you can use a basmas in combination with Voksha Churna. All those kind of preparations can be used here. And like I told, very important organ, liver. So during the treatment, to protect the liver, especially chemo, systemic damage, Rakshadika Shayam or Arogyavadinivati can be used. So this reduces the toxicity. So here there should be improved, functional parameters. The liver function test has to be taken every 2 months. Repeat LFT, KFT, and all that. At least 1 to 2 years following the treatments. Make sure to ask the patient to repeat this if they are basically cancer-free. So post-treatment therapeutic approach. This continues usually from 3 to 6 months. Okay, like soon after treatment, it continues for 3 to 6 months. And post-treatment, our intention is to enhance the recovery and function of all the organ. There is no toxicity. The patient is, beautifully recovered from the treatment side effects. So majority of the patients present with a state of Agni Madhya and Daurbhagya after the exhaustive and chemotherapy regimens. So chemotherapy, it destroys the natural, normal cells. So the patient definitely, at least 2 to 3 months, they will have Agni Madhya, Aruchi, and they will have fatigue and maybe associated with all that associated side effects might be seen. So we should not give any harsh medicines. Shodhana is definitely not indicated at this stage. You can try Shodhana, but only after 6 months. So you might feel like, okay, it is toxic, let me purge the person. No, that is not suitable. That is not a wise decision. Because like I told, you're driving the toxins deep. So in a Vishalipta person, we will not attempt Shodhana, isn't it? That's the same thing that is happening in a patient who's undergone chemotherapy. So your initial prescription should aim at Agni Deepti, but at the same time, it should not lead to Pitta Vritti. So mild Agni Deepti in the form of, mostly you give it in the form of diet. So ask them to add Shunti Churna to their diet, food. So like this, Trikadu can be used. Very safe, Agni Deepana preparations has to be used. Mala Shodhana is very important because if the patient does not eat, there won't be mala formation. Srodha will be there, chronic inflammation will be there, Velavardhana to improve the strength. So rasayanas can be given, mild Agni Deepana preparations can be given. So symptoms pertaining to Rasakshaya like Daurbalya, Ojakshaya, Pandu, Aruchi can be managed using Rakshadi Fanda. So Rakshadi Fanda is a wonderful preparation which will address all this. Daurbalya, it will take care of the liver. Again, Pandu will be taken care of. Along with that, you can use Anabhid, you can use Abragapasma, you can use Thapya Viloha, any iron related preparations can be used. Punano Mandura can be used. Dhatuloha can be given. Amalaki Chuna, Amalaki Rasayana, or Lehia. Nowadays, some companies have come up with Amalaki and dry fruits lehia. Something like that, which is tasty at the same time, which improves the Rasakshaya. Ishtimadu Churna, internally, so it will deal with the acidity. It is a wonderful antacid and it also heals the mucosa. Guruji Rasayana and Brahma Rasayana, those kind of preparations can be used here, which is not very strong on the patient. At the same time, it will help the patient recover. So condition is that of Pravara Vyadipala and Avara Rogipala. So it is not, we cannot say that just because treatment is over, the patient is cancer free. There is always this danger of cancer coming back. So we have to make sure there is no recurrence. At the same time, patient recovers effectively from the treatment. So Ahara Kalpanas has to be given more important here. Panchamula Siddha Kshira can be given. So it will help deal with the toxicity, inflammation at the same time. It is refreshing to the patient because they are using Kshira. So there will not be Rakshira in the body. Then Dashamula Yavagu can. So you have to modify the diet. You can give medicated mutton soup in patients who are non-vegetarians, or some kind of vegetable soup, modified vegetable soup, add shunti, add pippali. So these kind of modifications must be made. So this will address the aruchi at the same time, help in improving the dhatus. Pippali sadhita kshira. So these kind of, so this is how we introduce medicine. If it is tikshna, add along with ghee or give it along with kshira. Kshira paka can be used. Now, after 3 to 6 months, if the patients, so other symptomatic medicines can also be, you can also use Shankavati, you can also use those kind of preparations, Kankainavati, those kind of preparations can be used based on the strength of the patient. So I'm saying this, keeping in mind that our treatment should not add trouble to the patient. So after 3 to 6 months of Shamana Rasayana therapy, depending on the person's condition, Shodhana may be introduced to expel the deeper toxins. So by then, all the toxins will be nullified. And you can also use other preparations if there is skin skin reparations and all that. You can use Dushi Visharya Gada. Vilwadi Guttika can be, or Vilwadi Lekha can be, if there is vomiting sensation, nausea, loss of appetite and all that. So that way you just manage the patient. Then Shodhana is decided based on the Agni of the patient. So patient should be able to handle the, the entire Shodhana procedure. It should not further deteriorate the patient's condition. So these are the basic treatment principles we, following chemo and radiation. In radiation, Adhidakta and Ropana Chikitsa has to be done. Adhidakta both internally and externally. Pitta Shamana, Rakta Prasadana, and Daha Shamana. Muktyukta Kamaduda, it's a wonderful tablet in these cases. Pravala Panchamata can be used. Pravala Pishti can be used. Pishti is more effective. Ishtimadugruta. Internally, it is wonderful. It is a mucosa. Then Dushi Visha Chikitsa in case of chemo, both radiation. You can use Dushi Visharya Gadas, Vilvadya Gada and all that. Then Shodhana can be like induced in the form of Dushi Visha Chikitsa itself. Then Kalyana Grada is also very useful. If there is Shabdi Aruchi, all that can be managed with Lagu, Amapasana Dravyas in the form of diet. Shunti, Musta, Jeera can be added to the diet, added to the soup. So Amla Pitta can be treated using Pitta Madhura Yogas, Avipattikara Churna, Kamaduta, Ufa food, Pravala Pishti, all this Lagu Sushekar Rasa. Okay. Then xerostomia, like dry mouth, usually after radiation. So ask the patient to constantly sip anything that is sour. So it can induce salivation. Or you can use Yeshtimadu. Yeshtimadu Gruda itself is a wonderful preparation to stimulate the formation of saliva. And Karjuradi Manda can be used here, Rakshadi Fanda, etc. internally. Constipation can be treated using Snigdha and Roma Yoga, like Gandharvastadhyana and Taila. Mild, nothing strong, mild. Then One complication of radiation is pulmonary fibrosis and oral submucous fibrosis. So pulmonary fibrosis, like I told, fibrosis of the lung tissue. So here, for all this fibrosis, we have to start treatment soon after the patient completes the conversion treatment. Or else what happens, the patient usually comes to us after the fibrosis manifests. And it is very difficult to break the band and reverse the condition. Okay. So you can give, if the patient already has fibrosis, to break the band, you can use Shira Shappalagrata internally. Every day, them take 1 teaspoon grata, morning empty stomach, and to in oral cavity to prevent the fibrosis. What you can ask them to do Gandushan with Tilataila. Internally, you can give Kamaduda, Vati, Lagu Sushekar, etc. And ask them. So, what after fibrosis, what we usually do is that some patients will not be able to open the mouth a lot. So, it helps in opening the mouth as well. Let them do Gandusha. Then, internally, they have to massage the cheeks. So, you have to massage the insides of your cheeks, cheeks using the oil. Or also, if the patient has completed treatment a very long time back, you can also ask them to mix Pippali Churna with honey, apply inside wherever there is a tough bands, and ask them to massage. And then speed the secretion. So this will help to relax the bands and reverse the fibrosis condition. And if there is pulmonary fibrosis, definitely that will lead to pleural effusion. So pleural effusion with breathlessness, shortness of breath and all that, you can give Tippali Rasayana. So only if it is not malignant, because some cancer has a chance of spreading to lung. So you need to make sure that pleural effusion is not because of the disease and because of the treatment side effect. Okay. Tippali Rasayana can be used. Boruchanati is very useful in controlling the fluid formation. Swasananda tablet or the another tablet, all that will effectively control the shortness of breath. This Simulaquata is very useful. So additionally, you can use any other medicines that we use in case of Shwasakasa. Then radiation-induced proctitis. So this usually in case of cervical cancer and rectal cancer and prostate cancer patients. So mostly seen in cervical and prostate cancer patients following radiation therapy to the pelvis. So there will be damage to the rectal mucosa. Patient will end up with severe bleeding, burning sensation, pain, etc. in the rectal anal region. So here, in case of when it comes to conventional treatment, they do not have a lot of solution, and some patients are asked to undergo, colostomy. So imagine a patient, cancer patient who has undergone cancer treatment, and additionally they have to undergo colostomy and live with a bag. So this is a serious condition. So in this radiation-induced proctitis, we have wonderful results. So 6 months in the patient will be basically back to normal, nothing. Okay, this is one condition where we have like 100% result. What you can do if there is active bleeding, and you can give Raktasambhana preparations, Chandrakala Rasa, Kamaduda, all that can be used. Then Kushanuga Churna can be used. Ishtimadu Kshirapata. It is very useful in controlling the burning sensation, healing the mucosa. Internally, you can give 50 ml BD or 100 ml OD dose. Ishtimadu tablet can also be given. Kamaduda, Mautyukta Kamaduda, Pravala Panchamrita. And once the symptoms come down. Okay. Additionally, maybe you can go for Shatavari Grida if there is severe bleeding. Tikta Grida can be used along with milk. That also controls the bleeding. And some patients might require, Raktatisara treatment or Rakta, bleeding piles, what treatment we give. So we can give, Dusparshagadi Kashani can be used there, or Gudushyadi can be used. So based on the availability, and you can use there. And finally, when the symptoms come down, you can move on to Dadimani as a maintenance treatment. Or Teshimula Haritaki can also be used there to maintain the condition. Because these patients see maybe a mild stimulus like bending down while working or traveling in an auto rickshaw, or if they drink hot water. So all this can trigger bleeding because they have spontaneous bleeding. Okay, so so they have to be very careful about their lifestyle and the food that they should be on bland diet. No spicy food, no non-veg, and no hot water, no hot tea. So they have to be very careful. If controlling the lifestyle, if they follow Ayurveda, the patient will be cured within 1 year. Urinary incontinence and infection is another side effect of radiation, and also some chemo drugs. So there you can go for Sandra Prabhavati, anything that contains Shilajatu preparations, Okshirati Gugulu, Punanamantur, etc. can be used. Now, after the patient is recovered from the treatment, we need to maintain this. So we have to have ongoing maintenance treatment, which is long term. Until the patient lives, this has to go on. So Samana and Rasayana therapy to prevent recurrence and to maintain the remission. Virechana can be done every 3 to 6 months using Trivate or Avipati Churna. So all the pitta toxins has to go out. Periodic monitoring, we have to ask them to, go for a blood checkup every 2 months, CBC, LFT, and all that, serum electrolytes. Sometimes CRP can also be checked. CRP is an inflammatory marker. It shows if there is AMA in the system. And also assess patient's response, symptomatic response to the treatment. Based on that, we can make modifications. Lifestyle modification, they have to exercise. Movement is very important. Patients might feel like they're tired, they will be tied to the bed. No, it's not like that. You must ask them to move. Then integrate dinacharya, all that kavala, gandusha, mild abhyanga, walking and all that. So Ritucharya, Ritushodhana, every 6 months to 1 year, let them undergo Shodhana. And also sometimes, time to time, you motivate them, give them some sessions, let them meet, patients who have, similar experiences when they meet patients from the, same circle. All that gives them moral boost. So internally, oral medications, this can be continued for a very long time. Chavanaplasty can be taken. Suvarna Bhasma and Abraka Bhasma can be given to improve the immunity. You can also add Guduchi Sattva to that. Then Ashwagandha Shatavari Vacha Churna, bedtime, let them take it with warm milk. Punanda Mandura, if the patient is having fatty liver. See, some patients after colon cancer, after colostomy, they might have fatty liver. It can be grade 1, grade 2, doesn't matter. But allopathy doctors, they usually neglect this. So what happens? A person with fatty liver, a cancer patient, they definitely have a chance of metastasis or recurrence in liver. So you have to protect the liver, make sure that the patient's liver is functioning absolutely fine. So Punana Mandora is very useful. It is liver detox. If there is fatty liver, for sometimes you can also give Arogya Vardini, Punana Gugulu, or those kind of liver preparations can be given. Then Kanchana Ragu in case of non-Hodgkin's lymphoma or breast cancer patients, etc. To maintain remission, Kanchana Ragu can be given. Externally, depending on the strength and condition, Abdinga can be given with Shirabala Thaila or Dhanvandara Thaila, or you can mix. If there is pain, maybe take Karpuradi, Pinta Thaila, Dhanvandara Thaila, based on that. Okay, to improve the circulation and the nerve health. Because post-treatment, patients usually complain of chemo-induced peripheral neuropathy. There will be severe stabbing kind of pain in the lower limbs, which comes up to the thighs. And they might have this numbness and all that, loss of sensation. So to improve the nerve health and to make sure that the nervous system is not affected, Abhyanga would help a lot. Additionally, you can also go for, Sarvangadhara or Patrapinda Sweda, or once, after all the treatment completes, you can also go for Shashtirishali Pinda Sweda. It is very useful. Thakradhara for mental relaxation, Shirodhara with Brahmi Talak, especially ovarian cancer patients, post-treatment with the survival phase, they will have sleep issues. They'll have loss of sleep because of the hormone treatment and all that. So in those conditions, Shirodhara will be very useful. Udvartana, again, ovarian cancer patients. Post-treatment, because of hormone therapy, they might gain weight. So no amount of walking or exercise will not help them reduce weight. So here, Udvartana might help them to improve the metabolism and help them reduce weight. Next is Shodhana protocol for cancer patients. So we should have cancer-specific Panchakara protocol. In cancer patients, it's not the same when we administer Virechana or Basti. Okay? Because in spite of being a Bahudosha Vyadi, Rogi Bala has to be always considered. Otherwise, it might lead to Dabakshaya, Ojakshaya, and progression of the disease. So we have to make sure that Santarpana is given importance here. At the same time, taking care of the Srotas and the Agni. So safe Panchakarma modifications can be made, like gentle Mrudu Virechana using Triphala Eranda Thaila or Avipatikara Churna. So initially 3 days preparation using mild Pachana Vipana, then Mrudu Virechana. So you don't need a severe, drastic Abhyanga for 2 to 3 days. All those things are not necessary. Then give 3 days recovery using food. And again, after chemotherapy, at least you have to wait for 3 months for Shodhana to be administered. So because of this safe Panchakarma administrations, we can expect reduced hepatotoxicity because Pitta Shodhana is done, improved GI function, the AMA is not formed, enhance drug clearance from the system, from both liver and kidneys. And Basti, modified enema. So maybe you can go for, Yoga Basti, 8 days Yoga Basti. Again, it should be Yapana Basti. Basti we usually give if the patient is having constipation, pain, and all that. Matra Basti is usually preferred to control the pain. Or sometimes the patient might have severe constipation due to the vertebral metastasis involvement. Breast cancer patients, prostate cancer patients, severe pelvic pain, hip, the hip joint pain, all that. So in those patients, the constipation will be so severe, this is adding to the pain. And also morphine-induced constipation. So morphine, it will lead to constipation, which will again lead to more pain. So here sometimes Matra Basti using Hingu Triguna or Matra Basti with Erenda Thaila or Basti using Deshamula Thaila and Erenda Thaila. Sorry, Deshamula Kuata and Erenda Thaila. A mixture of this. 100 to 150 ml will be given immediately. So this will relieve the pain, inflammation, and constipations. These kind of modifications has to be made to Basti. Again, more than 8 days, we do not administer. And Yoga Basti is specifically given for chemo-induced peripheral neuropathy. You can use Dashamula Kuata. Dashamula Basti can be given. Or sometimes, Mustadi Raja Yapana Basti can be given. But some kind of Yapana Basti, including Shira, Grita, etc., can be used here. Nasya, if the patient is having loss of sleep or all that pain, sometimes because of the nerve involvement and lymph nodes pressing on the nerve, the patient might have headache and all that. Or to improve the cognitive function, reduce anxiety, all that, you can use Nasya. So 3 drops are instilled on both nostrils, 3 to 5 days. Give mild Shirabala, Brahmigruda, such that. Do not go for Anutaila and all that strong Nasya preparations. Next is pain management. So pain is one of the most important aspect of cancer. At least 70 to 80% of cancer patients face severe pain through, at any stage in their treatment journey. So we have 2 types of pain. One is neuropathy. The next is visceral pain. Neuropathy can be considered as Vata Jashula. And visceral, it is Pitta Jashula. So neuropathic pain, the reason is one is bone metastasis. The cancer spreading to the vertebra, pressing on the spinal cord. So here, Vatahara measures can be used. So Maharasnadika Shaya, Mahayogara Judu. Using Dhanvantara and Pintathaila or Dhanvantara Karpuradi, or you can also use strong medicines like Vishagarba, Mahavishagarba, etc. So Pichu has to be given constantly. Shirabala Avarti Thaila can be used. Niruha Basti can be given. And, make sure you give only 2 to 3 days, not more than that. Deshamula Niruha Basti along with Madhu Saindava, Sajradi or Erenta Thaila can be used. Then Matra Basti, later on Matra Basti can be continued using Dhanvantara Thaila. Then in case of peripheral neuropathy related pain, so you have to give Davani Gold, the Sumulashta has to be given, or any other patent product, product which contains Virathwada Chindamani, Mahayogara Gugulu, and Pravala Basma. All these combinations work really well. Then Shirabala or Dhanvantara Avarti Thaila can be given. Additionally, you can also give Mahayogaraja, Maharasnadika Shaya, the Shimula Kashaya, etc. can be used. Visceral pain is seen in patients of liver, pancreas mainly, GM malignancy. Okay, so here it is Pitta Jashula because of inflammation, all that enzymes, stasis in the pancreas, etc. Or stretching of the organ. The liver lesion, it is stretching and it's touching the nearby organs, nearby nerve. So that is why there will be visceral pain. So you can give Andhra Kutara Gutika, Shunti Swarasa with hot water if there is severe abdominal colic in case of gastric malignancy. Ashtakshari Gutika can be given in case of colon CA. Shankavati is very useful. Arikel Lavana, Bharat Kasturi Bhairavarasa, along with Shunti Swarasa. So when you are giving in visceral pain, make sure you give the tablet along with Shunti Swarasa so that the pain immediately comes down. In case of pain related to CA, pancreas and liver, Gulma Shula Chikitsa can be used. Ingostra churna repeatedly along with ghee or warm water. Or if you're giving tablet, you give 2 tablets 3 times a day before food. Dhanvantara Gutika, Shankavati can be given. Gandharvasadi Kashayam is very useful in CA, pancreas, and liver related pain. It can be given along with Gandharvasadi and Thaila. So there will be Mridu Virechana. When the stasis of the enzymes is released, there will be relief in the pain. Then, if all this does not help, you can also go for application of castor oil pack to abdomen. So nothing, it's just take some cotton gauze, apply thaila, maybe you can heat the thaila a little bit, apply that to the area of tetanus. If it is pancreas, the area of left side. Okay. So over a period of time, if we continue doing this every day, it will help relieve the pain and the patient will have mriduvilation also. If there is severe abdominal pain with cramps, then to the abdomen you can use Avagaha Sweda with Desimulakasha, mild Avagaha Sweda, not strong. Sometimes you can also apply Thaila, like the Salvana Sweda can be used. Apply this Lavana mixed with Thaila over the abdomen and give Mritu Sweda. Maybe that also relieves the cramps. Now, role of Ayurveda in advanced stages of cancer. So these are the patients whom we consider advanced stages and who are fit for Ayurveda, not fit for allopathy. Patients who are unresponsive to first-line therapy. So we can use Shaman Aushadhi to relieve symptoms, Rasayana Chikitsa to boost the immunity, Bala, and to manage the other symptoms, and along with the diet modifications should be given to these patients. Patients unable to tolerate conventional treatment. So they will have side effects, their disease progression will be there. So sometimes we have to reduce the treatment-related toxicity and then move on to medicine. So the patient's condition permits, you can use Mridu Virechana, like Sadhyo Virechana using Eranda Thaila, Havipatika Churna can be given. Then Pitta Shamana therapies to reduce the inflammation. Then refractory cancer cases. Vata Anulomana. So if the patient is not responding to the treatment and the tumor has grown after treatment, normally there will be severe Vata Prakop. So Vata Anulomana has to be given. You can use Snigdha Anulomana Drivya, Nimbamana Dheranta Thailam, or anything like that. Matravasti can also be used here. Stroto Shodhana to clear the blockages. So we have to reduce inflammation. Mild parts in the Deepan Aushadhis can be used based on the Agni, improve the Agni. Gentle therapies, like there is severe pain, mild Apyanga, using Mahamasha Taila or Matra Basti or sometimes Patra Pitta, all that. Gentle therapies, Shirodhara, those can be used in refractory cancer patients. Elderly patients who are above 70, 75 who are not fit for treatment. So here, Bala is very important. Brahmana Chikitsa, Rasayana has to be given. Amrita Prasha, Brahma Rasayanam or, Sthana Prasha can be used. Then focus on Santarpana. So diet should be main focus here. Give them soups. If they are medicated mutton soup, including the Bala Mula Kwata has to be added to that, or vegetable soups. You can ask them to take fruit juices or those your Yavagu, Shira Yavagu, all those kind of preparations can be used. Just a second. Sorry for the. So we should avoid harsh treatments in such conditions. Okay. So patients with comorbidities who are having diabetes mellitus, cardiac conditions, or who are having COPD, all those related conditions, we have to address the comorbidity. Based on that, we need to decide the treatment. So dosha-based customized approach has to be given. If they're having COPD along with some other treatment, you also have to deal with that. You can use another etc. Then Agni Deepana to support metabolism. Mild Agni Deepana medicines can be given. Mild supportive therapies to maintain the balance. So this is how we deal with advanced stages of cancer. Of course, you can use medicines. Medicines, I'm not going to describe what medicines to be given in particular cases, because that is again personalized. We do not have a standard protocol. But this is how we have to address advanced stage cancer. Always we need to give importance to their bala and make sure their diet is the main focus, and Santarpana Aushadhis has to be included. So again, advanced stages, we do not know how long the patient will respond. Sometimes it's all about just balancing the patient to survive for the rest of their life. So how do we deal with metastasis and cachexia? Metastasis, irrespective of the type of cancer, irrespective of the site of metastasis, you have to give Vatahara Aushadhis and Rasayana Prayoga. So if it is brain usually pitta involvement is more. Mritu Virichan has to be given with Gandharva, Sera and Taila. Brihatwadishandamani gold, Ekangadi rasa, Suvarna Susheta rasa, etc. So all the pitta hara, Rechana Dragas has to be given. Bone metastasis, Abagugulu, Mahayogaraja, Trayodashanga, pain relieving, analgesic preparations. And also whole spine pichu, Matra Basti, Niruha Basti, etc. can be used here. Case of liver metastasis, we are going to cleanse the liver, Pittahara measures, Arogyavadinivati, Bunimba Kwata, and Nayopayam Lehi. So in liver, in case of liver, there's a lot Vata and Pitta involvement. So you have to address it like liver cirrhosis or liver cancer. Nayopayam Lehi will help bring the Vyana Vayu to control, and also it will help in purgation. So the Malashodhana will be taken place. Gandharvasati Kashayam can be added to that, then another tablet. And if the patient is having fatigue, you can also give Suvarna Makshika Basna along with Amlaki Rasayana. And moving on to cachexia or Dhatu Park. So this is the last phase wherein the patient is totally, he looks like he was starving for a very long time. There will be muscle loss and patient is literally skin and bones. So this is a condition where they feel absolutely no appetite, no hunger, and the patient totally refuses food intake. So here, it is an irreversible condition, but we have to make sure that the patient should not die of starvation. Okay? So constant feeding is required. Laja Sadhyo Sandarpana, 10 ml every hour you can give. Draksha, Dadima, Karjura, Fanda can be used. Karjura Dimanda, like 10 ml or 20 ml. Every hour, that also can be used. Medicated mutton soup using Belamola water. It is very useful here. Amrita Prashaprita, again very useful in cachexia. Then Vasanta Kusumagara and Siddha Makaratoch. So gold preparations involving all the other metals and basmas. So this also helps in Sandarpana and Balya in case of Dhatu Paka patients who are. So these patients are basically going to die in a few weeks. Okay, so you make sure that they do not completely, there is no organ damage, that their organs do not completely shut down. So this is a case of an integrative approach in metastatic ovarian cancer. So here we have given Ayurvedic supportive and palliative treatment, and the patient is now basically cancer free. So this is a 68-year-old female patient. She had ovarian cancer. It was high-grade serous carcinoma of the ovary. So when she came to me, she was stage 4B, and the patient had severe constipation, bloating, loss of appetite, and anything she eats, she used to vomit, and there was severe abdominal distension. And the PET-CT, it revealed metabolically active solid cystic lesion in the right pelvic region. There was metastasis to the omentum, peritoneal, all that, entire lymph nodes, not just the abdominal, even just all that area lymph nodes, but there was metastasis to most of the lymph nodes. CA125 was elevated. So because the patient did not have appetite, constipation, she was not eating, we started with proper Ayurvedic medicines in the beginning. So they had planned for conventional treatment. It was neoadjuvant chemotherapy. So before surgery, chemo was given for 6 cycles. Then surgery was done because since she was taking our medicine along with that, she successfully completed the treatment. Most of the omental metastasis came down, all the lymph nodes, it was gone, and the tumor also came down. So the surgery was easy. Cytoreductive surgery, removing both the ovaries, total omentectomy, appendicectomy, and all the metastatic deposits what was there in the abdomen, all that was excised. And after surgery, she was given adjuvant therapy. So she was on capecitabine tablet. Now, this was the Ayurvedic approach we did. First, so phase-wise, you can divide this treatment. Phase 1 is pre-surgery, that we have given the preparatory or the supportive treatment before. So she had poor digestion, ama, agnima, there was present, constipation was there, lymphatic metastasis was there, and there was low immunity. So we strongly, we went for Agni Deepana, and since she had good strength and not undergone any treatment, it was very easy for me to plan the treatment. So I gave her Chiravilvadi Kushaya and Ingvashtoy Churna. Vata Anuloma, the Anandra was given. Constipation was relieved through Hingu Trigona Thaila. And Kanchanara Gugulu, we have to specific. And this Rasayana preparation was also given to her. So Hiragvasma, Abragabhasma, Shankhabhasma, and Suvarna Sushekharasa because of this involvement of hormones. Okay. So this combination was given at morning empty stomach along with ghee and honey. And this Rasayana treatment continued even during chemo and radiation. Then she had improved digestion. Her appetite improved drastically. Within 1 to 2 weeks, she was back to eating really well. There was no constipation. And during treatment, so once the treatment started, I shifted to Drakshadip. I made some modifications in between. And she completed the treatment without any major side effects. The next phase was like post chemo. So we needed hematological support and recovery has to be done. So her hemoglobin dropped to 7.9 and she also had chemo-induced fatigue. So Drakshadika Shayam, Paranam and Durham and Kanchanada Gugulu was given at this stage. It's been improved to 11 and there was no side effects further. Phase 3 was like post-surgery. Surgical recovery and again, there will be adjuvant chemo, right? So both have to be addressed. So since she was on capecitabine tablet, so we have some protocol for capecitabine induced side effects. You give basically Pittahara Aushadhis will be given. Bhautyukta Kamadutta, Pravala Panchamrita, we make a combination of this. Shuddha Gairika, Mustachurna. Okay, all together. 1 gram BD will be given with honey. Suvarna Vasanta Malati Rasa can be given with milk. Shatavari Gulam and Drakshadi Fanda can be used together. So this will help her manage the side effects. So she did not have any toxicity. The rest that might be liver toxicity, there might be skin-related issues and all that. Then her CA125 was normal. HP also is stabilized. Finally, after all that completed, PET scan was taken and basically she did not have any issues. She was basically tumor-free. And only thing we saw was like uric acid elevation was seen because of the capecitabine and other treatment-related. In ovarian cancer, it's very common. And risk of recurrence will be there. So now our intention is to prevent recurrence. And she had fatty liver. So these were addressed later on. So Rakta Shodhana, Ayurveda Kashaya tablets were given for a very long time. Aishwarya Gugulu was also given to control the uric acids. And systemic maintenance, Sandraprabhavati, Arogyavadini Vati, Indukandam Kashaya, and Drakshadi Lekhyam was given to these patients. Then her CH125 was stable. Uric acid and blood parameters came to normal. Sometimes it will be elevated, uric acid, and recently, we took 2 ultrasounds, and there was no, residual lesion or malignancy except fatty liver. There's nothing. She's basically in remission. She's disease-free. So recently, she's still under medication, and the only complaint she has is that because of the chemo-related, she has some pain in the lower back, and she also have age-related degeneration of the vertebrae. And because of that, she's having sciatica kind of pain, and for that also we're giving her medicines. So basically, this is how we deal with patients who are undergoing treatment, and this is how Ayurveda can support the treatment. So otherwise, I'm sure high-grade serous carcinoma, that was stage 4B, the patient would have had metastasis to liver, the patient wouldn't have successfully completed the treatment, so she might have passed away by now. So with combining Ayurveda and Allopathy, we can have a successful treatment protocol. So thank you for listening. You can, you're welcome to ask any doubts if you have.